Hello and welcome. My name is Chukwuma Awa. I am a biochemist and public health practitioner. I've been into the practice of public health for 8 years, and that has given me the opportunity to see firsthand the damage lack of health education can cause in the lives of people. And that also informed my starting this channel, Health Wise with Chuma. So today we are going to talk about breast cancer. We want to know what breast cancer is all about and what you or your loved ones can do to live a life totally free from breast cancer. Now, generally, cancer is a disease that occurs when there is an uncontrolled division of abnormal cells in the body. Now, when those divisions are happening in the breast tissues, it can be regarded as breast cancer. In Nigeria, breast cancer is the most common cancer amongst Nigerian women. It also accounts for 22.7% of new cancer cases in the country. So that is an epidemiology that actually calls for attention. Now, what are the risk factors of this disease? The first risk factor for breast cancer we will talk about today is being a woman. Being a woman now predisposes one to having breast cancer in her lifetime. Another risk factor we will talk about is age. As one ages, the chances of having breast cancer also increases because cancer is known to be an age-dependent disease. So another risk factor, the third risk factor we will talk about today is family history. When there is a relation that has suffered or suffers from breast cancer or even ovarian cancer, especially when that relation is a first-line relation, that is when it is someone's mother or sister or daughter, when it is a first-line relation, the person's chances of developing breast cancer is higher. So her threshold of caution should be high. Another risk factor for breast cancer is inheritance of mutated genes. There are genes known as, like the breast cancer 1 and the breast cancer 2 genes. Some people have been found through medical diagnosis to have inherited mutated or damaged versions of those genes. For them, the chances of developing breast cancer is higher. Another risk factor for breast cancer we will talk about again is sedentary lifestyle. So physical inactivity actually also predisposes one to having a breast cancer. So those are the risk factors for breast cancer, and it is wonderful we have known them today so that we can develop lifestyles that should enable us to avoid these risk factors and live a breast cancer-free life. So we also want to talk about the symptoms of breast cancer. What are the things that we will see, and it should make one to go to the hospital and check. One of the symptoms is presence of lump in the breast. When there is this lump in the breast, that actually feels differently from the surrounding tissues, it calls for attention. Another symptom for breast cancer we will talk about today is what we call nipple inversion. The nipple is the pointed outermost part of the breast. So when the nipple is turning inwards, it is a sign that should call for attention. Nipple inversion. We also have what we call nipple discharge. When there is a discharge of either a bloody fluid or a milky fluid or even a clear fluid discharging from the breast, it is something also that should call for attention. Again, we have this the presence of pain in the breast. Persistent pain that wouldn't go away, is also something that should call for attention. There is also what we call the dimpling of the breast. When there is the presence of dimples that causes puckering of the skin of the breast, like the texture of the peel of an orange. When you peel an orange, and look at the pill, how the pill is, there are dimples on it, that kind of appearance. When we have it in the breast, we call it the dimpling of the breast. So it's something that also should call for attention. So, these are symptoms of breast cancer which we have mentioned today. These are things or signs that the symptoms that we should, when we see, it calls, it requires us to go to the hospital, and seek for medical attention. So those are the symptoms of breast cancer which we have mentioned today. These are things or signs that the symptoms that we should, when we see, requires us to go to the hospital, and seek for medical attention. So those are the symptoms which we have learned today. I want us to also talk about breast cancer prevention tips. I like preventive medicine, so we want to learn breast cancer prevention tips. So the breast cancer prevention tips we are going to talk about today is screening. For me, as a public health practitioner, screening is very, very important in the lives of people. And the types of breast cancer screening that we'll talk about today are three. We have what we call breast self-examination. When one actually examines her breast from the age of 20, this is advised in women to once in a month check their breasts for the presence of any abnormality. One can stand in front of the mirror with the arms sideways and looking at the mirror, one can check for any form of discharge from the nipple, any change in the shape of the breast, any change in the texture of the breast. One can do that looking at the mirror. And again, lying face upwards, one can also, using the pad of the three middle fingers. These are my three middle fingers. Using the pad, this part of by putting the three middle fingers together, so using the right hand, lying face upwards, one can check the left breast, starting maybe from the base of the breast. You check round the breast in that manner, round, and as you repeat the cycle, you go upwards until to the area of the nipple, checking for any changes in the breast, either the presence of a lump, which you have mentioned earlier, or of any changes in the texture of the breasts. Now, also using the pad of the three middle fingers of the left hand, the same process can be repeated for the right breast. And remember, this is done once in a month, and it's advisable to do it after your menstruation, after one's menstruation, about 5 days after menstruation. So make sure you're not doing it during your menstruation. So that is it for breast self-examination. We also have what we call clinical breast examination. This is when also one goes to a doctor and experienced nurse to have her breast checked by a qualified health personnel. They now perform the recommended protocol in the clinic. That is clinical breast examination. We also have what we call mammography. It's a standard screening for breast cancer. That's usually done, by a doctor's recommendation. One goes to a diagnostic center to get a mammogram of the breast. It's an X-ray picture that shows the inner structures, the inner parts of the breast, to tell if there is a presence of lump or any other abnormality that is consistent with the presence of breast cancer. So it is wonderful that we have learned about breast cancer today, and I am so happy that this video has been made, because over the years of my public health practice, I have come across some persons that actually have breast cancer, and it is very disheartening when you learn that this cancer would have been diagnosed and treated at the early stages. But what happens is that you see people living with disheartening misconceptions that after having noticed these lumps, even with the pain and all that, they somehow believe that the lumps and the pain will go away when they take concoctions like aloe vera or olive oil or other concoctions that are taken out of disheartening misconceptions. But I believe that by this video we are now aware of what breast cancer is and what we should do to live a life free from breast cancer. And take a note that breast cancer is treated by doctors known as oncologists. They are the people that are qualified to handle cases of breast cancer. So, and any other treatment outside done by someone that is not an oncologist is not advisable. So live a life free from breast cancer. Adhere to these common health practices which have been proven to help one live a life free from breast cancer. So if this video has helped you in any way, I encourage you to share the link with someone and also subscribe to this channel. Thank you so much.